Welcome to Monroe Carroll Jr. Children's Hospital at Vanderbilt. You are being seen today in the Pediatric Urology Clinic. Today we're going to talk about bladder and bowel dysfunction. Before we talk about bladder and bowel dysfunction, let's talk about some basic anatomy of the urinary system. The urinary system includes the kidneys, ureters, bladder, and urethra. The kidneys filter the blood and make the urine. The urine goes down the tubes called the ureters into the bladder. Once the bladder fills up with pee, it sends a signal to your brain that it needs to be emptied. You then go to the restroom, the bladder contracts, and the pee comes out the urethra. Now that we know a little bit about the urinary system, let's talk about bladder and bowel dysfunction. What is bladder and bowel dysfunction? It is a medical term used when a patient has problems with peeing and pooping. This is typically a learned behavior in children where the muscles for the bladder and bowel are used incorrectly. This can cause many problems, such as recurrent urinary infections, urinary frequency, urinary urgency, urinary accidents, and even poop accidents. The good news is that with a little work, we can improve the problem and many times completely resolve it. How do we learn this behavior, you might ask? Well, it starts by ignoring the signals your bladder sends to your brain. You might do this when you're playing outside, watching TV, or maybe when you're at school. Sometimes we get so busy with what we're doing, we don't want to stop and go to the restroom. Adults, do you ever see the child dancing around, holding themselves, crouching down, or even crossing their legs? This could be a sign that they are ignoring their bladder signals. It's called bladder and bowel dysfunction. So what about the bowels? Many children that ignore the signals from the bladder also ignore the signals from the bowels that tell them they need to poop. The bowels sit right behind the bladder, so as the rectum fills up with poop, it can push on the bladder and cause problems filling and emptying. Now that we know what bladder and bowel dysfunction is, what do we do about it? There are three main things that we start with to treat bladder and bowel dysfunction: timed voiding, avoiding bladder irritants, and treating constipation. The first thing we're going to talk about is timed voiding. As soon as you wake up in the morning, go pee. From that point on, it's important to pee every hour and a half to 2 hours until you go to bed. Make sure everyone is on board with this plan, including parents, teachers, babysitters, and anyone else that is involved in your daily routine. Sometimes we have to be reminded to go pee, and that's okay. Even if you don't feel like you need to pee, you should always go try. The next thing is avoiding bladder irritants. Bladder irritants are things in our diet that cause the bladder to be irritated or angry. Bladder irritants can be anything that is caffeinated, carbonated, dark colored, anything that contains red or blue dye, or too much dairy in the diet. We need 2 to 3 servings of dairy a day for our bone growth, but more than that can cause bladder irritation. Some examples are blue sports drinks, dark colored sodas, or anything with fizzy bubbles. These can be really irritating to the bladder, so we recommend you avoid those as your bladder is healing. Lastly, we want to treat any constipation because, like we talked about, the rectum sits right behind the bladder, and if we are constipated, the bladder can't work properly. Many children are constipated. The goal is for every child to have a soft bowel movement every day or every other day without straining. Things that can help with constipation are making a potty time. About 20 minutes after you eat, go sit on the potty for 5 to 10 minutes. Other things that can help with constipation are increasing your fluids and increasing fiber in your diet. Sometimes we recommend using Miralax to help with constipation. We might even recommend a Miralax clean out to jumpstart the process. Now you know what bladder and bowel dysfunction is and how we treat it. It is very important not to give up. It can take 6 to 8 weeks to see benefit with this treatment. So be patient, be persistent, and remember, we're here to help. Thank you for listening, and I hope you have learned a few steps on how to have a happy bladder.